Hello, it's Nikki Harman here. I'm known as the Mindful Nurse and I am the founder of the Inner Space Project. I'm just here in Swanage on the beach in Dorset, and actually I'm feeling a bit cold because I've just been sat in a nice warm cafe with a hot chocolate, and being told by people who aren't in Swanage that it's really sunny where they are and they're enjoying some spring sunshine. But we have got the lovely Swanage mist blessing us today. Thank you very much. So I just wanted to talk about what it's like for children to be in a hospital environment and how anxiety and pain can have a dramatic impact on their stay. And if you're a parent and you've had children in hospital, then and they've been an inpatient, or if they've been involved in having uncomfortable procedures, maybe some physiotherapy or rehab therapy, ongoing treatment that they might be having, then they can be quite anxious about it and quite worried about it, and that can have an impact on them emotionally as well. So that's why I've written a course aimed at people who work with children professionally in the clinical setting, in the clinical environment, and to teach these people how to teach children meditation techniques and mindful activities that can help them and really benefit them. So, for example, I will share that I once looked after a 15-year-old with some chronic pain who had a chronic illness and had been in a lot of pain for quite a few days and had been in hospital. I hadn't really wanted to leave her hospital room, her hospital bed, and I did some meditation work with her. I did a sort of a guided 15-minute meditation with her and asked her about her pain score before and after I'd done the meditation with her. And actually I helped her reduce her pain by half just by doing a 15-minute meditation with her. And then she was getting wet feet. Then she was able to leave the room and go off and enjoy some time doing other activities in the schoolroom. And I did some other work with her which helped her come to terms with her pain and just helped her to deal with it in a different way. So it can really help. The meditation and mindfulness has lots of scientific basis. It's more than just what some people might consider to be the mumbo jumbo stuff and all kind of soft, touchy-feely, not really beneficial, not really helpful, but actually it can be very, very helpful indeed. And I am really passionate about helping these children, whatever age they are, and their families, their parents and relatives and the people who look after these children, how to combat pain, stress, anxiety, all sorts of things. Even the anxiety, the anticipation of having to have an uncomfortable procedure or to have an operation, to have a blood test and have needles stuck in the child's hand or arm, and they may have had other experiences in the past which make it more difficult for them to accept these procedures and become more anxious as a result of past experiences. All these things can be helped with training in learning how to teach these children meditation. And I would love to be able to do this with people. And I'm working very hard at enabling this to happen. So if you're a parent and you've had children in hospital as a patient, then I would love to hear from you about your thoughts on whether or not you feel it would be helpful for your child to be taught by healthcare workers how to use meditation and mindfulness as part of their clinical toolkit. So it's not just about taking blood pressures or pulses and doing all the kind of the really clinical stuff. There are other aspects of it as well as including distraction. But mindfulness and meditation definitely has a big role to play in helping children who are patients in the clinical environment. So I'd love to hear from you. I'd love to hear your thoughts on that. And equally, if you're a healthcare worker, a healthcare professional in any capacity, maybe a play specialist, a physiotherapist, an occupational therapist, a nurse or a doctor, healthcare support worker, please do get in touch with me. I'd love to hear from you. I'd love to hear your thoughts on this subject. So yeah, that's it for me today. It's been good to chat to you, and I'm going to go and get in the warm now because I'm very cold. Anyway, thank you for watching, and bye bye.